Do you need help with marketing, new clients, or online reviews? MassageBook is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Plus, sign up now with code ABMP50 and get $50 off after your free 30-day trial. Visit massagebook.com, create an account, and transform your practice today. That's MassageBook with code ABMP50 for $50 off. Don't wait. Give it a shot today. Are you looking for a company that empowers your growth and development? Look no further than the Elements Massage brand, where all massage therapists have the opportunity to thrive through the Elements Massage Career Advancement Program. In the Elements Massage Career Advancement Program, Elements Massage Studios recognize, reward, and uplift their massage therapists, rewarding continuous learning, commitment, and growth. The Elements Massage Career Advancement Program includes professional, elite, and master levels, where massage therapists will enjoy higher commission rates, access to continuing education and development opportunities, and unique career growth opportunities to propel them toward a successful future. Evaluate your career and apply to an Elements Massage studio today. Visit elementsmassage.com/careers and take the first step towards a fulfilling journey. That's elementsmassage.com/careers.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. Today's story is a pretty simple one. It's about a topic that seems to be commonplace to everybody else. I know other massage therapists have had similar questions to this one. But frankly, I had never taken the time to look into this before, so I'm really glad to have had this opportunity. And in the process, I discovered all kinds of confusing labels, so I'm inviting you to come along and get confused with me, and then we'll get it all sorted out. And the story goes like this. I have a question that I can't find the answer in the pathology book, and maybe because I have an older edition. This is Ruth, by the way. No, they had no problem with the book, it just isn't in it. And the contributor goes on to say, I have an adult client who has hand-foot-mouth disease. Thankfully, I found out before she came, she got it from her grandkids. I'm wondering how long. What do I advise her about returning for massage? That's one thing I definitely do not want going through my office. I've Googled some information about it. It states that once fever or any blisters are gone, but then there's a but that it could be spread for much longer. Do you have any thoughts? Much appreciated. Also should mention she was diagnosed with strep at the same time and has had lupus for a number of years. Okay, so we have something fairly simple, hand, foot, and mouth disease, or HFMD, but in combination with a couple of situations that might make things more complex, strep throat and lupus. So we'll come back to those in a bit. HFMD is a viral infection. The causative agents, and there are several that can cause this disease, are mostly enteroviruses. That is, they belong to a family of viruses that often affect the GI tract, and they are spread typically through direct or indirect contact at the mouth, nose, or eyes. Most of the viruses that cause HFMD belong to the Coxsackie virus family, which is why the term Coxsackie is sometimes used as a synonym for HFMD. This viral infection can affect anyone. But most patients are very young, 5 years old or younger. As viral infections go, this one isn't that terrible. It can cause uncomfortable fever and sore throat, and itchy blisters inside the mouth and on the palms and the soles. Sometimes the genitals and buttocks get blisters too. Most people find that the fever subsides in a few days, and the blisters are almost always cleared up within a couple of weeks. It has a very low, but not zero, risk of complicating to a central nervous system problem like encephalitis or meningitis or a few others, and that can get very serious, but this is most likely to happen in very young infants or in adults who are immune suppressed. Oh, hold that thought. For most people with HFMD, though, it means a few days of not feeling well and a couple of weeks before the blisters heal up entirely. Affected children who are in school are even told that they can return to class as soon as they have no fever. So all this sounds fairly benign and sort of like, okay, fine, who cares though, right? Except HFMD is incredibly, fabulously, riotously contagious. It spreads through daycare centers and preschools like wildfire. And while it is not usually dangerous, it isn't a picnic either. And remember what I just said about immune-suppressed people being more at risk? That can include people with autoimmune diseases that they treat with immune-suppressing drugs. Diseases like, let's see here, lupus. But we'll get back to that in a minute. I checked into immunity for HFMD, and I found that yes, indeed, people do develop immunity to the causative virus after an infection. But this disease can be caused by lots of different members of the Coxsackie family, and immunity to one confers exactly zero protection to any of the others. So it is definitely possible to have HFMD multiple times. And because this is the way my mind works, I thought about other diseases that might be easily confused with HFMD, and it turns out there are a few. So here are a few things that HFMD can look like, but it's not. Let's start with impetigo. Impetigo is a bacterial infection, could be strep, could be staph, including MRSA, or any combination of those. It's usually associated with young children like HFMD, and some people even call it infantigo, thinking that it refers specifically to infants. Like HFMD, impetigo is fabulously contagious, but it usually creates sores that scab over with light-colored crusts on the face, not on the hands and the feet. Impetigo infections do not confer any kind of immunity, but they do respond to antibiotic treatment, which, of course, HFMD does not. Chickenpox is another childhood rash that might fall in the same bucket as HFMD, but as we know, chickenpox as a childhood infection usually involves an outbreak over the whole body. And we do develop a kind of immunity to this viral infection until our immune system doesn't work so well and we might get shingles. And of course, we have covered that topic in a few episodes of I Have a Client Who. And also, there is a vaccine for chickenpox, but not one for HFMD, with the exception of a vaccine called EV71 that is effective against only one of the viruses that can cause this infection. There's another childhood rash I just have to share with you because the label is irresistible. This is called infantile acropustulosis. Oh, infantile acropustulosis. Now, don't panic. Let's just take this apart. Infantile means it happens mostly in babies. Acro, that's extremities. And pustulosis, pathologic condition of having pustules. So, pustules on the hands and feet of babies. Sounds a lot like HFMD. Here's what eMedicine has to say about it. Infantile acropustulosis is a recurrent, self-limited, pruritic, vesicopustular eruption of the palms and soles occurring in young children during the first 2 to 3 years of life. First described in 1979, infantile acropustulosis is probably much more common than the scarcity of reports would imply. The really good news about acropustulosis is that it is not contagious. But here's a fun fact. It often, but not always, follows infestation with scabies mites, which is definitely contagious, and that might keep me up tonight. Hand-foot syndrome is another confusing label This is a painful condition that is sometimes a complication of chemotherapy. It is also called palmar plantar erythrodysesthesia. Hand-foot syndrome is directly related to a response to chemotherapy drugs. It is not the result of a viral infection. It damages the skin. It lasts a lot longer than 10 days. However, just to make things more complicated, people undergoing chemotherapy are immune compromised, and that means they are more vulnerable to Coxsackie infections. So on top of their hand-foot syndrome, they can also develop hand-foot-mouth disease. And lastly, as a part of the list of things easily confused with hand-foot-mouth disease, I present to you this search engine stumper, foot and mouth disease, which is also called hoof and mouth disease. This is another viral infection. It causes fever and blisters on the feet. However, there's a really important difference, which is that humans don't get it. It only affects other animals, mostly those with cloven hooves. Among domestic animals, that means cattle, goats, pigs, sheep, and rarely llamas and alpacas. Among wild animals, this goes further, of course, to affect water buffalo, antelope, deer, and bison. And here's a head scratcher. Hedgehogs and elephants can get foot and mouth disease. Neither of those have cloven hooves. Hoof and mouth disease can kill animals, but it's more likely to cause lingering illness and reduced productivity. And as I mentioned a moment ago, humans can't get foot and mouth disease. Will I tangle you up forever, though, if I mention that all those animals that can get foot and mouth disease can also get hand, foot, and mouth disease? Ha ha! Okay, that was a fun little maze, but let's just pull back for a moment and take stock of what we've learned. Hand, foot, mouth disease is a viral infection, but it's caused by a lot of different Coxsackie viruses, so we probably will not ever develop full immunity. There's no vaccine for the majority of these causative agents. It mostly appears in young children, but adults can get it too, especially if they are immune compromised. It is extremely contagious. It causes fever, sore throat, and blisters on the palms, soles, and sometimes the buttocks and genitalia. And almost all the time, it is self-limiting, that is to say, it gets better on its own and not threatening. And it can look like or be confused with a whole bunch of other things. Now, let's think about our client, who, by the way, also has lupus and is recovering from strep throat. Well, that turns out to be highly controversial because it is really easy to confuse the sore throat of strep throat with the sore throat of HFMD. I looked at several resources that warned against this confusion in children. Of course, HFMD is viral and strep is bacterial, so a simple throat culture will sort this out in a hurry. I don't have any details on whether this client was officially diagnosed with strep or not. It's certainly possible, given her predisposing factor of lupus. Then I turned my attention to the lupus-HFMD connection, and I didn't find much. A couple of case reports are in the medical record where a person was comorbid with both diseases, but it does not appear to be a pattern. But we're left with the most important question that our contributor submitted. When is it safe for this client to get massage again? Partly in relation to the client's well-being, of course, but also in relation to the safety and health of the practitioner. As our contributor pointed out, we don't have absolutely solid, true 100% of the time data on how long someone with HFMD may be communicable. Well, here's a spoiler alert. That is true for most other infectious diseases, too. We make best guesses. Most of the time we get it right. But the consensus among experts appears to be that when blisters heal and the fever is over, the risk of spreading infection is low to zero. Does it make a difference that this client is immune compromised? Probably not to the massage therapist. Her blisters might heal more slowly maybe. She probably needs to take extra care not to get sick again. But I cannot make a case that her lupus status puts the massage therapist at risk in this situation. So I say, let's wait for the fever to subside and for the blisters to heal, and then let's get carefully back to work. This client probably really misses her time with you and will be grateful to get back on your table.
Anatomy Trains will be holding our flagship Anatomy Trains Structural Integration ATSI training in beautiful Vancouver starting September 16th, 2024. Progressively build your anatomical knowledge, hands-on manual therapy techniques, and most importantly, seeing and understanding postural patterns and developing strategies tailored to individual needs. We warmly invite you to apply today and bring your bodywork career to the next level. Visit anatomytrains.com for more.